Okay, we're going to go ahead and get started. I want to welcome everyone to our webinar today, The Nature of Health, Exploring the Links Between Health and the Physical Environment. My name is Stacey Barter. I work with BC Healthy Communities, and we're one of the partners that hosts these webinar series along with Northern Health. We've been running this series now for about 3 years, and I'm really excited about today's session. We have a fabulous panel of guest speakers who are going to be sharing their thoughts and insights about this topic. And I'd like to start by inviting my colleague at Northern Health, Teresa Healy, just to share a little bit about the Citizen Series in general. And Teresa, if you could share a little bit about why we chose this particular topic and why we thought it was relevant.
Northern Health had actually been hearing a lot from our practitioners, community activists across the north, about the difficulty of accessing training and education and professional development, how expensive that was. And frankly, in the north, from about October to May, travel is often key. So in concert with BC Healthy Communities, with whom we'd had a working relationship, we really came up with the idea of the Citizen Series, that it would allow us to bring the best of information and speakers to the north. And in every webinar, we try to have a speaker based in the north, somebody from the province, and then a leading expert from beyond. And the series has grown beyond our wildest expectations. But it really was grounded in that if the mountain won't go to Mohammed. And we've been getting always very positive feedback. We're always looking for suggestions to improve or suggestions.
The conference is now being recorded.
And so this partnership has really, we think, opened up a very important resource to people and communities in the north.
Thanks so much, Teresa. So we're really excited about today's session, which really is looking at how health is tied to the settings where we live, we work, we play, we learn. And I think this is going to be a particularly interesting topic because in my experience I find that conversations about the environment are often really isolated from our conversations about health. So we're really going to be exploring where the links are, where there are opportunities to really work in community to make these links, and what are the possible roles for citizens and communities to help make these links on the ground. We have a fabulous panel of guest speakers, as I mentioned. We've got Dr. Gislason joining us all the way from Scotland. Dr. Margot Parks is joining us from the University of Northern BC, and Joan from Fraser Basin Council Smart Planning for Communities is here today. Each of these women have a lot of experience in this field, and I'm really looking forward to the presentations. How we're going to structure the webinar is we'll start with our panel. Each of the presenters will share their presentation for about 10 to 15 minutes. Following each of the presentations, we will have time for a short question and answer period if you have particular questions for any of the speakers. And just a reminder that you don't need to wait until the question and answer period. You're welcome to use the chat box to type in your questions and comments throughout the presentation, and we'll come back to your questions. And then following the three presentations, we do have time for a group discussion as well. And I've participated in a lot of webinars. What I find is that people often listen in, and it's great to learn from experts. We also hope that this can be a space where we can have some dialogue. We know there are a lot of people on the phone and on the webinar today who have tremendous experience working in community and working in these areas. So we hope that you'll share your insights and your experience as well. And please don't feel shy to participate and speak up or use the chat box to share some of your ideas and experiences from your communities. To start off, before we turn it over to our guest speakers, I'd like to get a sense of who's on the webinar today. So I'm just posting a poll here. Everyone should see a poll that asks where you're from. Are you from Northern BC, another part of BC, or outside of BC? So you can just click on one of those and we'll get a sense of who's on the call today. I'll give a few minutes for that. Great, I see them coming in. So it looks like we have about half the folks on the line, well, a little less than half from Northern BC, several folks from other parts of BC, and then we've got a handful of folks from outside of BC as well. That's great. This series, as Teresa mentioned, is really meant as a learning opportunity. Initially, the idea was that it would be a learning opportunity for communities in northern British Columbia, but we often have folks participating from other areas of the province and beyond, and we find that that really adds to rich discussion where people can share from different contexts. So welcome to everyone. I'd like to also get a sense of where people work or who's participating, if you're representing a particular organization or a particular perspective, if you're a community member that's just interested in the topic. So I've just pulled up another poll here. You can let us know who's participating today. Give another couple seconds here for people to get their answers in. Okay, and I think everyone should be able to see we have quite a cross-section on the call today. Quite a few others. We're not sure what other is. Quite a few health professionals, a number of people from educational institutions, a number of people from local governments as well, I was just reflecting that this week is actually the Union of BC Municipalities Convention, so I know a number of our colleagues with local governments are tied up there. Looks like we also have a lot of people from community-based organizations, and then some folks who are just interested community members and representing environmental groups as well. So that's fantastic. Warm welcome to everyone, and really look forward to hearing your thoughts and perspectives as we move into the discussion today. Just going to ask Claudia to pull up the first presentation, and I want to extend a warm welcome to our first guest speaker today, Dr. Gislason, who's also a dear friend of mine. Very excited that she can be on the call. Maya is a medical sociologist who studied and works with the Centre for Global Health Policy at the University of Sussex in the UK. She's calling in today from Scotland, so we really appreciate you being here today. Maya, I know you were dealing with different time zones and dinner time for children and all of that kind of stuff, so very pleased to have you on the call today. Maya did her doctoral research in the UK, focused in the area of ecological health. She's from Canada, however, and has a really rich history of working in Canada as a community educator with a number of nonprofits in BC and in Latin America. So I'm really excited to hear Maya's presentation, sort of setting the big picture of ecology and health and putting that in context for us to understand what is this movement of eco-health and where are people across the globe starting to make those links. So welcome, Maya. Just a reminder, if you are muted, you want to hit *6 for people to be able to hear you.
Thank you, Stacey. Well, good morning. And indeed, it's evening here in Scotland. And as Stacey said, it's a pleasure to be here. And my heart is in BC with you. And my time spent in northern BC in particular has shaped me a lot as a human being. So I feel honored to be part of this call. So indeed, my task is, as Stacey said, about twofold. One is to think just a little bit about some ways of contextualizing this subject of ecology and health, and then very much to introduce, in a couple of different ways, this newly emerging field of ecological health, and then to pass it over to Margot, who will bring you into the region, and Joan much more into community. So that's where we'll begin. And one place that I thought of beginning, because it's hard to know exactly, is to begin with this notion of the Anthropocene. And what is being, there's a movement afoot right now where people are beginning to suggest that we used to think about ourselves as living in the geological period of the Holocene, which began about 10,000 years ago, and really with the rise of recorded human history. But what's actually happening is about 250 years ago, with the Industrial Revolution, our human imprint on the Earth has really changed, and we're now what many people are calling living in the Anthropocene. And that's because humans have come to influence every aspect of the Earth on a scale akin to the great forces of nature that were shaping past geological eras. And I think starting here with this notion of the Anthropocene is useful for a couple of ways. One is that it highlights that humans are playing a determining role in producing the human health injuries of our time, even if they're attributed to environmental drivers. What we see behind them is the hand of human activity, and anthropogenically driven climate change is a great example of that, because while we've had climate fluctuations across the course of the history of the planet, it's in this moment in time that human activity is driving a new kind of complexity and speed at which climatic change is occurring. And there's also, partly why I wanted to share this is because there's a good news element to this story, and that's that if human activity is producing some of the key environmental health determinants of our time, if we shift our thinking, which drives our actions, well, then we can actually have a significant and appreciable impact on reducing environmentally driven health injuries. And I always think a little bit of a good news story is a good place to begin. Now, on this slide, we're moving already into the subject of today's webinar, which is really about the environment and health, and thinking about the environment as a context for health. And we have this notion, this quote from LaBelle that says, you know, it makes sense that healthy people need healthy environments. But a key question driving this webinar is how do we actually express those insights in the ways in which we think and work, and very much the ways we apply that to building healthy communities and working in the health sector and so on. And it behooves us, I think, to take a moment to think about, well, what are we actually talking about? The WHO says that health is the state of complete physical, mental, social well-being, and not simply an absence of disease and infirmity. And, you know, we can decide where we stand on that. But for the purpose of today, I think we can also think very much about health as tied to social, economic, and personal activity and development, and very much is determined by the settings in which we live, we work, we learn, play, shop, and vice versa. And we can think about the environment in terms of a health setting and a health determinant as not only a built environment and a physical space, but very much a natural one. And then we can see that health settings are actually embedded in the physical environment. And of course, communities are very important, as we're the groups of people with rights and privileges and activities affecting a certain place and space. But as this slide also draws our attention, it's that a lot of these conversations about health and the environment and even community well-being and development are very isolated, and they're difficult to bring into conversation with one another. And the complexity of each of the issues that reside in each of the spheres, the cogs, is part of that issue. But there's more to it, and we're trying to figure out ways to address that. So in this slide here, we see that one way to begin to think about it is to change our way of thinking about what an environment is and how it is a context for health. And so we begin to take these images of nature theoretically unspoiled, or nature kind of impacted in different ways by the human presence. And if we begin to view these spaces through a socio-ecological approach to health, then we actually can begin to link environment and society together. And so when we do that, then we can begin to think about where is health within these health settings, and how is healthy and the environment connected, and to really spend time developing tools for doing that. And so how we see the environment changes. We can see now within the health picture, it's the relationship of health to soil and water to health and so on. The other thing that we begin to do is to think about healthy settings, to reorient our thinking. And when we have a health sector that's becoming, and a community development sector that's becoming interested in complexity and in the nuances and dynamism and importance of the natural world, then our focus can begin to move upstream. We can begin to think about the health service but also to move upstream to think about healthy settings as embedded within natural environments, and begin to look at the cycles that are implicated within those. So in a sense, we're trying to greenhouse settings, and we're trying to bring some red into natural environmental activity management and consideration. And I've put in an image here that's from my backyard, a lovely Scottish pastoral image, and I can guarantee you that it's raining here just now. But it's just to highlight the idea that every environment is different, and so too will our responses be. And so we have this ability to not only think globally, but to bring that into our local thing. So this principle. So all of this thinking and awareness is being formalized and developed within many different areas, but one of them is the product of a lot of work from people working in human, animal, and ecological health sectors, and them coming together to build transdisciplinary ways of thinking about health. And so what we have is an emerging field that's looking at how changes in the Earth's ecosystems affect human health, but it's doing it by examining the different elements, the biological, physical, and social, and so on. And it's also involving a lot of different disciplines and trying to bring different perspectives together and so that we can understand how an ecosystem predominantly affects human health. And then to build really practical, innovative solutions within the different sectors that people are working. So in a sense, it's a very transdisciplinary effort. And I just wanted to draw your attention to the fact that this community is actually formalized enough that it's expressing itself as an international association for ecology and health, and has this wonderful journal. And certainly people are always invited to participate and contribute in this community. So this is a very brief introduction to ecosystem approaches to health, to ecology and health. I thought I would spend just the last few slides talking to you a little bit about ways in which this kind of work is grappling with some of the principles of integrated thinking about health and ecology, and then a couple of ways in which it's expressing this awareness in looking at very big picture health problems, and then Margot will take it into more and more concrete examples. So what I have here is 3 different circles that express ways in which the different circles within which kind of an ecological health approach works. It works in the nexus of awareness around what's happening in animals, wildlife, and domestic animals, the disease burdens they have, ecosystem functioning, and then human diseases and human health is on the bottom right-hand corner of the slide. And then we can see all the different forces and factors that are causing shifts to happen. And so when we look at health, when we work at health in the center of this Venn diagram, with all this awareness and consideration, we start to do different things with health, both looking upstream, but also looking very much into the past to look at how the present moment has been produced. Now, this is a great aspiration, but it involves a lot of complexity. And this slide is really to bring to your attention that when we're trying to innovate and we're trying to learn together and learn how to learn together and develop new frameworks, there are different kinds of awarenesses that have to be grappled with. And so when we bring, for example, ecological thinking into conversation with population health thinking, we have to do things like work across a variety of scales, have multiscalar thinking, and we have different sorts of preoccupations, bodies even, that we're interested in within the ecological framework, where we move, in a sense, from the galactic through to this ecological focus on biospheres and biomes and ecosystems and so on. And we're trying to look at the contribution these ecological systems make to human health. But also we're trying to bring this into conversation with population health thinking, for example, which has a very different, more socially focused set of preoccupations, and the scales aren't quite linking up. But they're also incredibly important. We're looking at forces like politics, social forces, economic and cultural ones. And we move through a pyramid of thinking, not starting from the galactic, but rather, global health through to national health regions and so on. And there is an awareness within population health thinking of biological forces, biological endowments, for example, physical and social and environmental exposures, gene-environment interaction. But how to actually bring these into conversation is certainly a big challenge that we have to work on within the field of ecology and health, but also within our own work within regions, community development, and the northern health context. So all of this is getting distilled, and ways of refining this approach are being developed. And the next couple of models I'm going to show you are examples of the ways in which this thinking is being distilled down into tools and models that are available to elaborate upon, to check, to challenge, and to really build on in our regional and community context as well. But one is drawing attention to the relationship, the important relationship between ecosystem services and human well-being. And this is a diagram from the Millennium Ecosystem Assessment that identifies the kinds of services that ecosystems offer to human well-being, supporting ones, provisioning ones like food and so on, regulating ones like climate regulation, and also draws attention to the importance of the cultural dimensions of the natural world. And then in a complex expression of how this affects human well-being, as you can see from this gradation of brown and arrows, it looks at how ecosystem services impact security in terms of well-being, material dimensions of basic human well-being, health, and so on. And so I think that this is one of the frameworks, one of the basic acknowledgments that is being used to shape thinking about human and ecological well-being and their interfaces. And the last slide that I want to show you before I hand this over to Margot in terms of thinking is to use another example from environmental change and the health impacts of that. And what this slide shows is that we can also use this linked up thinking, this integrated awareness of human health and ecology to think about environmental change and its health impacts. And you can see in this slide there's a great awareness to the principles raised in this notion of the Anthropocene, where it's escalating human pressures that are affecting the global environment that are then being expressed as things like climate change or biodiversity loss or urbanization and its impacts. And then the health impacts that are direct ones, climate change leading to natural disasters such as floods and heat waves, but they can also be secondary, so ecosystem-mediated health impacts, the kinds of infectious disease emergences we're seeing that are environmentally driven and so on. And then also there's an awareness that there are indirect and deferred and displaced health impacts, the mental health impacts of livelihood loss or floods or population displacements and things like that. So it really allows us to have a very big picture. And our challenge is really to apply that in a meaningful way to our local context. And so this final slide is really to make that gesture, to take this big picture thinking and to begin to put ourselves on the map and to begin to apply this thinking to our reality, our biomes, so the different communities of vegetation and all the organisms that we live in. And this arrow points to kind of northern BC and the realities that we live there in terms of biomes, but also drawing our attention to the interaction biomes have with anthromes, which is this notion that global ecological patterns are also created by sustained direct human interaction with ecosystems, and to invite reflection on what are the anthromes in our regions and communities, and how are they interacting with biomes, and how is that impacting where we live and work and play and so on, and what do we want to do about it. So that's really the overview that I wanted to offer, and then I would like to pass this over to Margot, who's going to bring you much more into a grounded northern context.
Thank you so much, Maya. that was great to set the big picture context, and I really appreciate the challenge and all that's happening around trying to mix these different disciplines and really promote this kind of linked up thinking that you're talking about. I also loved the slide of your backyard, and it made me think about the context that we all live in and how that affects so much of how we live and the context for health. So that was a great highlight to see the different slides between northern BC and then your backyard in Scotland. Thank you for that. We do have time for a couple of questions for Maya. If anyone has any specific questions or comments, you can feel free to use the hands up icon or to type them into the chat box. There is one question asking if Maya's slides will be available after the presentation, and they will. They are all available on the BC Healthy Communities website for download right now, and we will pull them up on the webinar platform just at the end of the webinar today, and you can download them directly to your computer. So you can feel free to do that. So if there are any questions, you can feel free to ask them now, and there will also be time at the end of the panel for further questions. I had one question, Maya, which is, you've left me thinking about context of mixing disciplines. And I'm wondering, I mean, I know you do a lot of work in different contexts around this. I'm wondering if you can share how you see this happening. So, for example, trying to blend these disciplines with ecology and the health sector, for example, what are some concrete examples of how you see that playing out? Like taking the health sector, for example. Is this shifting the way the health sector is working?
I think that's a great question, obviously. I think it's a fascinating question. I think that there are different ways in which that's being expressed. Within the ecological health community, there's definitely a commitment to transdisciplinarity. So there's a commitment when a team is assembled to work on an issue through an ecosystem approach to human health framework. The effort is really to make sure that various disciplines are actually represented on the teams so that different ways in which an issue is occurring can happen. For example, if there is an infectious disease emergence, trying to understand not only the microbiology that's occurring within a human host, an animal host, but also to try and look at how environmental shifts are impacting where vectors and hosts might eat or live, and if that's changing if that's changing how humans and animals, perhaps bats or rodents are interacting and so on. And we have examples of this with hantavirus, even in British Columbia, Lyme's disease and so on. So these would be ways in which and also how social structures and cultures are changing. So what are people actually doing in communities and how are they interacting with forests or things like that. So I think that's a very not a succinct response, but I think one of the efforts is to build teams that learn how to think about the issues differently. But outside of the eco-health context, I think that there is an acknowledgement that that ecology has something to do with human health. Within public health organizations, more and more veterinarians are being hired to contribute to human health issues. And so I think while the framework might not be as integrated, the awareness that it needs to happen is growing, and the hiring structures and the kind of committees that are being formed are reflecting that.
Thank you so much, Maya. I think that's a great lead into Margot's presentation, where I know she's going to be talking about some specific examples of how people are interacting with the ecosystems in northern BC. Just before we move on to Margot's presentation, just a reminder again to everyone that we ask you to mute your phone line. We are having a little bit of background noise, which means someone doesn't have their phone muted. So you want to hit *6 to mute it, or if you have a mute button on your phone, you'll want to use that. And also someone pointed out early on in the session when we were doing the polls to find out who was on the line that in some cases, while the poll allows only one answer per site, in some cases we actually have multiple people sitting around a phone participating in the webinar. So before we move on to Margot, I'd love to see who is actually on the line and participating today. So just invite you using the chat box if you could let us know where you're participating from, if you're representing a particular organization or community, and if there's more than one of you, let us know how many are in the room. We'll just take a minute to do that while we're getting set up for Margot. And I'll go ahead while people are typing in where they are and how many of them are in the room. I'll start by introducing Margot. I'm so pleased that you can be part of the webinar today. Margot is the Canada Research Chair in Health, Ecosystems and Society. She's also an assistant professor at the School of Health Sciences at University of Northern BC, and she's also a clinical assistant professor with Northern Medical Program at UBC. She is originally from New Zealand, but has been in Canada for a number of years, and my understanding is that her original training actually is as a medical doctor. But now a lot of her research is focusing on the impacts of ecosystem change on the social determinants of health, especially in the context of watersheds in rural, remote, and Indigenous communities. So I'm really interested to hear more about that and to start looking at how do some of these concepts apply on the ground in Northern BC. So we'll turn it over to you, Margot. Again, you'll just want to hit *6 to unmute your line. And you can, while Margot's getting set up, you can see people are putting where they're participating from and how many are in the room. So we've got a great representation on the call today. Thank you.
Thanks, Stacey. Can you hear me okay?
Yeah, we can hear you fine. Thanks.
That's great. So I'm sitting here with a big grin on my face, enjoying the company of 8 of us here in the Centre for Healthy Living in Prince George. It is really a pleasure to be participating in these webinars. Such a great idea, and really neat to have this group of colleagues sharing insights. I realise as I look at my opening slide, I could spend my entire 15 minutes just talking about this slide, because there's a lot of meaning in these images here for you. One of them is that Maya has really set the scene on the global context, and I really love that image you may see from her first slide. And in some ways, as I made my transition from my foundation in health, a lot of my foundational work was international, and so very involved with the International Association for Ecology and Health, the journal EcoHealth, and so on and so forth. When I came to Canada, I have been very involved with a pan-Canadian initiative, the Canadian Community of Practice and Ecosystem Approaches to Health, supported by a really interesting Canadian institution, the International Development Research Centre, that has had an incredible leadership role in helping this kind of thinking to develop internationally, and also to support learning and exchange in Canada. And some of the names I saw on the call were alumni of some of the summer schools that we've taught. But it was always, my work does really come to life in real places with real people, in real communities and real environments. And so the image that I have here that you'll see a couple of times of people walking up a hill together captures for me such an important idea, which is that we have to learn how to learn together. And in answering your question earlier about crossing disciplines and crossing, we have to actually find ways to spend time together learning how to learn together. And this is an image of a group of people from about 6 different kinds of institutional contexts walking up a hill to go to see a site of a river restoration project in Vanderhoof near Prince George. And it's beautiful, this can be fun, but there's also this element of hard work. We have to be committed to walk up the hills together. So a lot of what you're going to hear about are insights from a particular hill walking exercise that we've been doing in Northern BC. It's at the bottom of the slide, the EcoHealth and Watersheds in Northern BC project. And this has been a project that's come to life since I have been at UNBC as a Canada Research Chair. The little image of the hands, some of these presentations I refer to getting wet and dirty. And the reason I mention that is that there is a reality around our physical context that we are so often divorced from, and it is when I think climate change is a brilliant example where somehow climate change ends up in the sky and we forget to land it in the places that are providing our water, growing our food, and really figuring out what does this look like. So I'm hoping that some of these things will come to life as I swing through these slides. So you're going to be hearing about a Northern Health position paper on the environment as context for health, and a couple of Maya's slides actually drew from that directly. And in that work, where importantly, there is a necessity to translate some of these ideas back into language that the public health community is familiar with and is aware of. And we're building on strengths that already exist rather than saying, now you have to do a whole lot of new things. And so you're going to hear about how thinking about settings and the settings for health is a way, it's a very easy way for us to start to bring this to life. We're going to talk a lot about this idea of unusual allies. I have Julie Kerr and Teresa sitting in the room with me, and we've had a lot of conversations about this, that we're talking about new kinds of partners for public health and the fact that these are not issues that public health will always lead on. There's sometimes ways that we have to figure out other roles. We might need to convene, to facilitate, to moderate, to actually be part of the change processes that extend well beyond classic health sector issues. And you're going to hear about a particular project, and I'm going to be touching on words that I think are extremely important in this context, like governance. So I've referred to watershed governance at the bottom of the slide. You're going to hear more about that. But when I use that word governance, I want you to hold in your mind this idea of governance as this question of how we make decisions, who we involve, and how we hold those people into account. And the times are past when that process of governance relies only with government. Governance is now a much more diverse concept, and a lot of what we're talking about is not just about moving between disciplines, but moving between the multiple people that have to be engaged, and how we're making decisions based on what knowledge, how we're putting the pieces together, who we're involving, and how we're moving through these ideas. So here's a slide that says the position on environment as a context for health, and this is something I'm extremely proud of. It was a position that was approved by the Northern Health Executive, representing the results of a couple of years of work with UNBC and Northern Health, particularly a project that's been funded by the Canadian Institutes for Health Research, where Ronald Chapman, the Chief Medical Officer in Health, and I co-chair a project where we wanted to take the lessons from that project and use the Northern Health position process as a way to profile these ideas. And you can find these ideas in the documents that are handed out. But we're talking about taking a fundamental shift from protection and health protection to promoting safe and healthy environments. Now, that doesn't mean we don't have to do health protection anymore. This is not the message. The message is that we need to continue to do health protection and use our excellence there, but we also need to connect with this broader idea of the positive side of the environment, not just the nasty things in the environment that make us sick. Let's count them, count the sick people, try to stop people being exposed to the nasty things. We want to create safe and healthy environments for people. So I really challenge you in this talk to not do the thing which is to think, I have to do this or something else. We're talking about doing this in addition and building on the strengths that we already have in public health to do this kind of thinking. So one of them is to stop this dichotomy between the social or the environmental. We want to talk about how these things interrelate, and Mayer's talk about the Anthropocene and bringing those ideas is saying we are part of the same system. It is a false dichotomy to separate them. Sure, we do it sometimes for pragmatic reasons, but this is an opportunity to think differently. And that what we're talking about is connecting up the settings where we live, work, learn, and play, and overcoming a certain ecological blindness that has existed in how we think about that. And I'm coming back to the unusual allies here. So this is the goals of this position and the position that is available on the Northern Health website and was approved in June this year. So this is a slide. It's actually the same slide you saw from Mayer. I'm not going to reproduce the context, but I'm hammering home. We saw cows before on this slide when Mayer showed it, and I'm now showing you an image of from UNBC looking out over Prince George. And so it's this idea that we have to land where we are when we're thinking about these ideas. But amazingly, the health settings work that we've done in the past has been quite ecological blind. We're talking about healthy schools anywhere, we're talking about healthy hospitals, we're talking about healthy communities, but sometimes forgetting the absolute ecological embeddedness of the difference between, although we could have seen cow scenes like Scotland and Caledonia, I guess. But anyway, there is always very concrete place-based things to think about here. And so This slide is it's actually one of the essences of the position paper, which is to say that there has been an enormous amount of work done in the familiar things on the left-hand side. And when I say familiar, I mean for people familiar with health promotion and healthy settings ideas. We're talking about healthy schools, healthy workplaces, healthcare, healthy communities. But what's happening in that area is people are saying, wow, we really do need to connect better with the environmental context. So we've been talking about this idea of working towards the green edge of healthy settings, realizing that every setting is embedded in an ecological context, and that will involve, for example, the community garden project in a school, what you choose to grow there. You know, that's a really concrete example, but there are many other things. But on the other side, there is a whole lot of bigger picture ideas that the more traditional environmental context, and we're talking about words on the right-hand side here of healthy parks, watersheds, airsheds, food sheds, things that people have lumped with the environment folks, but we're talking about the healthy edge of those settings. And we're wondering about where we can find synergies, particularly with existing programs in the middle here, where these things are talking to each other and we're not having to all reinvent the wheel for the health initiatives to all start new projects, but rather to partner in new ways. So this is an image that was very exciting to produce. We wanted to try to capture a visual image that sort of brings some of these things to life in northern BC context. So it's I've just blanked on her name. Colleen Stevens. Thank you. Colleen Stevens, who's does this amazing work, produced this image. And where it comes to life is that we tried to land all of these settings in this context. So here I've got watersheds referring to the waterway, but importantly, in fact, much of this entire image is a watershed. Every point on land that you stand on is part of a watershed, because watersheds are draining the landscape into that river, and so we're embedding watersheds into those settings. We're thinking about food sheds. What is it that's having to flow, the systems ideas that Maya introduced, what's having to flow and move into where we produce our food, and where is that then flowing, and how are we thinking about that? We're thinking about airsheds in Prince George. This is a very topical issue, but it's so too in many landscapes. Now, one of the reasons it's a big deal in Prince George is because of our geological context. We have a climatological system because of two rivers and low-lying landscapes that mean that we get inversions and really significant air pollution issues in conjunction with the big industry that is a big part of the economy here. So we need to understand those things in a bigger context. And I think a very exciting area is this whole healthy parks, healthy people, sometimes healthy by nature idea, that it's kind of some of it's in catchy phrases like green time, not screen time. Some of it's in the work that's saying let's get healthy eating and active living happening in landscapes that are meaningful, and it's a sort of thing that most parents intuitively understand, but what can we programmatically do to connect up these dots? And there's a lot of work happening in that area. And so within that, we land our more familiar settings approaches, and we recognize the connections between them. We wonder if they could talk to each other, if there could be a connection between that schools project and the Healthy Parks and Healthy People project. We start to see that we could actually team up together to do the same idea of getting kids out involved in an environmental stewardship project, learning about where their food comes from, learning about salmon and understanding why that's a really important system. So we're seeing connections we might not have otherwise seen. And I'm going to swing through here some slides about one of the contexts that this thinking has really come to life for me. I mentioned earlier the watershed context and why it is that this is a universal idea. In every landscape, we are standing in a watershed. I say to people, think like a drop of water. If I land on this piece of landscape, where am I going to drain to? Am I going to drain, as we would, into a part of the Fraser and then all the way out to Vancouver, or am I going to go into a groundwater system and actually spend 10,000 years getting back into the system? Where am I going to go? We're all part of these systems, and we're physically part of them. The water comes into us, it goes out of us. This is part of who we are in the larger context. There are also contexts that challenge us to think, how do we actually take care of what's happening and the health consequences of these ideas? And in particular, in the BC context, we happen to be sitting in the Fraser River, and that's a context where I'm going to talk a little bit about the intersectoral connections that we've been making in northern BC. So this is my I have been working in the watershed context in New Zealand and Ecuador and Hawaii. Coming to northern BC, I was learning about some of these connections here. And this is a really interesting little couple of maps here. Here's Northern Health, an area the size of France, and we've got it overlapping, but not exactly overlapping, with this massive system, the Fraser Basin, that is 80% of the land area of British Columbia. And we've got sort of conversations waiting to happen between these kinds of things about what it is that we do. And certainly Joan's work, founded with the Fraser Basin Council and other initiatives, will examine that. When I arrived, one of the first groups I met was the Regional Drinking Water Team, a very clearly, explicitly intersectoral effort to try to understand what's happening in terms of water resources and drinking water. But I learned new language when I moved here. It was health in relation to the dirt ministries. And the dirt ministries is forestry, oil and gas, environment, agriculture, all those people that do with non-people things. But actually, there was a massive common interest here. And this group was learning. They were saying, we've got lots that we could be thinking about differently. And we started hearing about real-world issues that were bubbling up in watersheds around the north. And this particular trio has become involved in a project where we are learning how to learn together, looking at improving social and environmental determinants of health in the context of watersheds. And I could spend 2 hours talking to you about some of the ways in which this project has worked, but I think one of the important things is actually us finding creative and innovative ways to find touch points for where people's day jobs overlap in a way that they didn't realize, that they could work together in exciting ways. And so one of the top images is from the launch in the art gallery. Other images are examples of that little spaghetti diagram isn't from this project, but it's an example of the kinds of ways that you can move between silos of things. You can start to find connections. But the really exciting thing was I've got a formatting problem there, but we did a fabulous rich picture exercise with our colleagues. These are Chief Medical Officer of Health, highly trained climatologists, watershed people, drawing to each other. What are the issues? Where are the connections? Why does it matter what you do and what I do? We be working together. And so this has generated all sorts of new insights that we're trying to target into specific workshops to help equip people to make these connections better. And we have one next week with members of the team. So although I could spend a lot of time talking about that project, what it led to was this. We said, how can we take some of that message and back translate this into ways that might resonate for people in terms of their core public health business? And that's really one of my final comments here, is that this is not a sideline for public health. It is actually deeply embedded in what we recognize as core competencies. I think it's important to just step back and say, well, why have we not been talking about it? What is going on there? And to be honest about some of the reasons why that may occur. But importantly, to say, there's all these synergies waiting to happen. I might just have to step slightly sideways and connect with different kinds of organisations to be starting to see these connections in terms of the core competencies for public health. The Canadian core competencies document says public health values include equity, social justice and sustainable development, and that those ideas should not be separated out, but they should be put back together. And there's a lot of very exciting momentum happening in Canada around this. The Canadian Public Health Association is revisiting from 20 years ago its Human Health and Ecosystem Health document to start rekindling how these ideas can get embedded. So with that, there's a lot of people to thank and acknowledge. I also do, as I said earlier, the international scale. These are local acknowledgements, but the international scale needs to be acknowledged in terms of the broader international eco-health community, and also the kind of leadership that's happening in Canada through IDRC funded projects, through our COPA Canada work. That is all feeding into this coming to life in places like northern BC. So thank you.
Thank you so much, Margot. That was fantastic. And I really appreciated you highlighting this shift from, well, as you said, not a shift from health protection to promoting safe and healthy environments, but it being a both and the great concrete examples that you offered there. We do have time if anyone has any specific questions for Margot. You can feel free to let us know. I'm seeing people are using the applause icon, saying hooray, hooray. Thank you, Margot. So if there's any specific questions, you can raise your hand or just type into the chat box. Again, there will be time at the end of the panel if you have any further questions there. Lots of applause coming in for you, Margot. Thanks so much.
Great. Thank you.
That was wonderful. So if there are no specific questions for Margot at this time, well, I'll give people a couple minutes there. And while those are coming in, someone had asked if a recording is going to be available of today's webinar. And yes, an AV recording will be available on the BC Healthy Communities website following the webinar. We'll send you a note to let you know when that's online. And as I mentioned earlier, the slides, the presentations will also all be available. They're actually there already in PDF format. So I see that there's a few people typing right now. We'll give people a couple minutes to get their questions in. Margot, I wonder if you want to share, you shared a bit about the watershed work that you're doing. While people are typing, I wonder if you want to share any other specific examples in the north that you've seen where these synergies are really happening at community level to link across disciplines and making those links.
Yeah, well, my first response to that is I do encourage people to realise we are talking about linking beyond disciplines, and these words interdisciplinarity and transdisciplinarity seem to make it the job of universities to do the connections. You know, that some geeks are going to sit there and talk to each other and suddenly we're going to come up with a solution, and I don't really think that that's the case. I think that the word transdisciplinarity is interesting to me because trans means beyond. It means going to other forms of knowledge, other knowledge cultures, other knowledge strengths, whether that's First Nations and Indigenous knowledge, whether it's community knowledge, whether it's local place-based knowledge, whether it's stories. So I think some of the ways that comes to life, people associate me with water, and they associate me with that clear liquid that we sometimes see coming out of a tap. But I think that the key message about the watershed thing is that everything is there in the watershed. So I'm looking across the table at Lorena Stevens here, and we've had a lot of conversations around the connections between water and food. And for me, food is water. Water is food. They're very much interrelated. And so the food area and all of the tremendous intersectoral work that's happening with food is another place where this is coming to life. And for a lot of people, that's the issue. They care what they're putting into their mouths. As one of my dear colleagues, David Waltner-Taves, says, eating is the most intimate thing that we do. We are taking the world and putting it in ourselves, and it is more intimate than anything, and I ... So it is, it is extremely, but so is breathing, as David Suzuki will point out to us. Breathing, when we're breathing the 10,000, we're breathing the same air that Plato breathed. You know, we're talking about things that are, this is the way that our world is. We are a product of our world. We are nature thinking about herself, some colleagues of mine would say. So I think in answer to your question, Stacey, it's almost like you can take any community project, whether it's a food-based project or whether it's a healthy eating, active living project, you put it in its context and you make the connections explicit, rather than saying, oh, that would just confuse it. I think there is a richness and there are synergies to do, and you can do it from things that don't seem directly related to the physical environment. I'm sitting from, Nancy, and that we were talking about tobacco and smoking legislation and so on. There are ways that we can put that in context. So the context piece is the message, and that would be my little thought exercise for people. Think of any kind of community-based, place-based project and put the physical environment back into that context, those living creatures that Maya referred to, and you will see, I think, connections to strengthen your work.
Wonderful, thank you. We have a couple of other questions from your presentation, Margot, and then we'll move on to Joan's presentation. There's a question here, where does culture fit into all this? Cultural attitudes towards the environment and towards health. Is there room in there for change and influence on the overall environment and health? So I don't know if you have thoughts you'd like to
Oh,
share.
well, yeah, absolutely. I'm glad that question comes up because absolutely. I mean, if the word socio-ecological means anything, then we're talking about how the social dynamic is how is it that people are connecting and learning together and creating social norms and building cultures and points of reference. So culture has a lot to teach us in terms of ways in which different cultural norms have influenced our attitudes. And an obvious example, but it's not the only one, is the thousands of years of Indigenous and First Nations knowledge that can inform our sense of holism and interconnectedness and reciprocity. This idea in the Ottawa Charter of reciprocity, of mutual reciprocity, where we're taking care of ourselves, each other, and our natural environment. And we're doing that in an integrated way. So absolutely culture is important both in terms of understanding, it's also important in terms of change processes. And I think the Creative Act, one of my heroes in this field, talks about the transdisciplinary imagination. She talks about bringing the creative, putting Humpty Dumpty back together again is often a creative act. You know, you have to think about things in new ways. And you know, it's the Albert Einstein quote that we don't solve problems with the same thinking that created them. So we have to actually challenge ourselves to step out of our comfort zones, to find ways to learn to each other, to get your colleagues who are super experts in areas to draw pictures to each other, or to have events about health and environment in an art gallery, or to get, as I saw a mention about health inspectors in the questions, and you know, the work that Lucy's Beck has been doing with the health protection team here of creative ways to see health protection in a more fulsome way in the broader community context. There's all sorts of innovations beginning there, but we shouldn't be naive. There's a lot of we have to foster a culture of learning, speaking of culture, and I think that learning organisations, and I think Northern Health shows how that can be done. They have to really figure out new ways of making these connections.
Great. Thank you so much, Margot. I see there's a couple of other questions, and I'll hold those until we come back to our discussion period at the end of the panel. I'm going to turn the floor over now to Joan Tess, who's my colleague at Fraser Basin Council's Smart Planning for Communities program. Joan is a registered professional planner. She's also the current president of the Planning Institute of British Columbia. So she's worked for more than 25 years in community and regional planning, mostly in northern BC and in the interior. And she was for many years the regional manager for Fraser Basin Council's Upper Fraser region, and now for the past 4 years has worked with the Smart Planning for Communities program. She's going to talk to us a little bit about the role of planning and community planning in making these links. And so I'm very much looking forward to your presentation. So over to you, Joan.
Great, thank you, Maya, and great, thanks so much for asking me to be part of the panel. I just wanted to bring some of those ideas that Maya and Margot have presented to the local level, and also a bit of an overview of how planning can help how these things happen, because I think sometimes people you know, think, oh great, this almost happens within a few weeks, but it doesn't. Of course, it takes time and effort by whole. So I'll be touching on that, and just as a planner, I've always been intrigued by the interaction between ourselves as humans and our built environment and our natural environment. So this is a really topic for me too. And I'm going to start off with that actual town planning. Our tradition of town planning was originated in Great Britain as a response to some very unhealthy conditions that happened in cities because of the Industrial Revolution, you know, the coal burning at the time, the soot. Horses were the mean of transportation. There was a lot of nutrients there left behind by them, you know, which was a problem, and that's how the separation of where people lived, you know, was removed, you know, moved away from issues that started that a century ago, really. So anyway, okay, so we'll head on. First, I was going to say with this first slide, here's a great example of a human settlement in a watershed there. This is for Margot, especially. This is Lillooet on the Fraser River, farther south. So just a quick bit about what we do at Smart Planning for Communities. What I do in my day job, we work with local and First Nations governments to help them pursue this idea of sustainable communities. And by that we mean, you know, the social, the culture, the environmental, and the economic aspects of it. But part development, make you aware that we do include the environment, the natural environment as part of that, this whole idea of sustainability. Probably most of you in the audience out there are familiar with this, but just as a brief refresher, this is the most common definition, and this was one of the first ones that was out there. The idea began as sustainable development by the Brundtland Commission in 1987, so this idea has been around 20, 25 years even, and with this idea of what we do as humans doesn't affect the natural environment, and that all those aspects of our lives are important. You know, we need the clean air, water, food, timber, minerals, education, healthcare, transportation, and so essentially looking at this is, you know, how do we ensure the long-term well-being of both people and the land or the ecosystems in which we live. The idea of sustainability began several years later, and you've probably seen this image of a 3- or 4-legged stool, and you know, all these elements that make up part of our life, and in this idea of when we make a decision, all aspects are affected one way or the other, whether directly or indirectly. And it's not the either or. I use it's a health analogy, but of your heart and your lungs, like saying, you know, choose between jobs or the environment. Well, choose between your heart and your lungs. You can't, right? We need both in order to live, and so we need all of these things to be healthy individuals and communities. This thinking, though, has evolved again over the years, and more lately now it's a series of nested eggs. Go to the next slide there. And this image really recognizes two main points, in that everything we do and everything we have occurs in or comes from the natural environment, and that also that the economy and our culture are creations of a society, and that, again, society exists within the natural environment, within the ecosystems. And so this approach of this thinking of sustainability tries to acknowledge that and incorporate all these elements into this larger context of things that we do. And so also with the sustainability planning approach, some of the principles that are involved are particularly taking a long-term view, so not 5 or 10 years out, but 40, 50, 60 years out. You know, the decisions we are making now, what does that do for the future, our future well-being? Being broad in scope, again, all this culture, economy, society, the environment, and the integration and collaboration that's required to be thinking this way. Again, as Margot and Maya have pointed out, that we need to be thinking more comprehensively and how we approach these things and who we like and who we partner up with. So I'm going to go to some local examples now, but the whole thing around planning, though, it gives us the opportunity collectively as communities to think about our future and where we want to be and how we're going to work together to get there. And I'm going to hazard a guess that probably 99.9% of all the communities I've ever seen when they're doing this kind of, you know, community planning or for their region, that they include the words healthy and vibrant or sustainable in their descriptions of their future. So these examples now are mostly, I think they're all actually from northern BC, so I didn't realize we were going to have so many participants from elsewhere in BC, but I'm sure you have these same kinds of projects in your areas. So first of all, so these are the hands-on things. So how are people taking these ideas and making them become a reality in their community? So these are fairly common, but again, just say that these are the kinds of things we can do at the local level. So first of all are walking and bicycling networks. And this is an example, well, this is not an example, this is Terrace. So hi, David. I see David Block was one of our participants there. David's a planner with the City of Terrace. And this is the Grand Trunk Pathway. And the smaller inset is from Dawson Creek. So mostly with the walking and cycling networks, there are two goals. One, there's both recreation and transportation. So recreation, the healthy living, we can get out and walk and, you know, cycle, but it's also a means of transportation, so we are less reliant on our vehicles, and that helps reduce emissions and greenhouse gases and local air quality as well. So there's that broad context as well as the more direct things. So making these things happen, though, takes some efforts and some years. Usually a municipality will have their official community plan that designates the corridors and the routes, using both the purpose-built paths, as we see here in this example, as well as streets. Sometimes streets are part of the systems, and I believe a colleague of mine was commenting that they were at a conference, planning conference, that might have been in the U.S., and that one of the main speakers was the commissioner, I think, of planning from New York City, and she said her best tool was paint, cans of paint, marking laneways for bicycles or pathways and that kind of thing. So sometimes these things can be fairly simple and straightforward, but it does take budget. It takes some coordination within municipal departments to make things happen, and as well as within the community. Bike clubs and community service clubs can help with fundraising and with the volunteer aspects of it. And I know a lot of local governments, everybody's strapped tight budgets these days, but even doing a bit each year, 10 years, you can look back and go, wow, look at the system we have. Same thing as planting street trees, they're small when they go in, but give them 10, 15, 20 years and you have these levels. That's that example. The next one are community food gardens. Very popular in the last 5 to 10 years. I think we see them in most communities now across British Columbia and including in northern BC. Usually it's a local community group. A gardening club will approach their municipality and say, geez, can we use the corner of this public park and put in a community garden, and then the plots are created and individuals and or families. But I wanted to share with you 2 particular examples. And this one in the picture is from Prince George, but also again Terrace had a similar situation. Both cities had former gas stations in the downtown core, and they've been kind of left and not looking too great. And oftentimes these sites are called brownfields. However, in Terrace, the local gardening club sought permission and received it from the oil company that owned the spot to use it for a garden. And they have done that, so it's much more colorful and a nicer spot. And in Prince George, the community garden, the former gas station site was actually bought by one of the local credit unions and had sat vacant for a bit, but some volunteers approached them and said, can we use it for a garden? And so there are many individuals involved. There's a couple of community clubs that are involved, as well as individuals. And some people grow the produce that they grow. They're donating it to local food banks and shelters, and other people can grow their own food if they're on income. And everybody who walks by and drives by enjoys this really colorful site right in downtown Prince George, so it's great. And one of the things I just wanted to is a small inset picture there of the women who are planting there. This was just last spring. They're using broken, those are garbage containers. They're on wheels, but they've been damaged, and they got them from the city, and they've adapted them a bit to grow. But once the site is going to be for a new building eventually, but when the time comes, they can just move this whole garden to another spot. So it's very, very movable, which is kind of neat. So, okay, and another example here is the farmers market. This is in Smithers, the Bulkhead Valley Farmers Market Association, and their mandate is to encourage and educate people with local production, and they do include crafts as well as food. They also have a winter indoor location, but this is all the part around the healthy eating, healthy living choices, and people are often drawn to to buying and consuming locally grown veggies and meat in the interest of health. It also becomes a social hub. There's this very important part of our health is the sense of belonging and connection with our community and with obviously family and friends. And so this is, as you can see, people are chatting there. They're having a great visit while they're out on their morning buying their veggies. It also contributes to local economic development, and it supports a lighter environmental footprint because the transportation is, and as well, often these growers will use organic methods properties. Farmers markets can also be part of downtown revitalization strategies. With the indoor markets during winters, oftentimes it leads to light, which can be used year-round. There was a study done by Dr. Dave Connell at UNBC's environmental program. He did some research a few years ago around farmers markets across British Columbia. It's a great study, and you could probably go online at UNBC to Dave Connell, C-O-N-N-E-L-L, and find his paper there. But one of the things he found is, and this is the part of the local economic development, that the farmers markets had a really big a positive effect on the businesses close by, adjacent businesses, because people tended to stay in the area, and then they would also do other errands. Very positive thing all over. And I also wanted just to comment on this slide. You can see in the background, of course, Smithers out there in the northwest and amongst the mountains, is that I thought, again, this was a great slide showing you. Here we have our human settlements, our towns within this whole ecosystem around us, and that backdrop to the market. And then one of my, getting towards the second to last examples here, air quality. Margot touched on that a bit, but I also wanted just to describe a bit more about the interjurisdictional nature and collaboration, collaborative approaches to this. This picture particularly is from Quesnel, and I'm not picking on industry, but it was an individual, a local volunteer, some years ago approached both the forest companies in Quesnel and the Ministry of Environment about the local air quality, about the concerns she had, what they could do together. She wasn't pointing fingers, but she said, obviously, we need to work together to work on our air quality. And a roundtable was created, and they have made some improvements there. And in Prince George as well, actually about 20 some odd years ago, there was a very technical management committee formed between the companies and the Ministry of Environment, and they again worked on a lot of improvement and in the reduction of the NOx, I'm trying to think of the names, like the sulfides and the nitrates, I think. I don't have the correct chemical phrase there, but those parts of it. But then particulates, very fine particulates, became a concern with community as far as the health, because those are the bits that we breathe in. It's not the stuff you can smell, that, as I've been told and has been described to me. It's not the stuff that you can smell that will harm you. It's the particulates that very fine ones that you can breathe and get into your lungs. So this initial technical committee did kind of morph and it evolved and included nonprofit and community organizations, and more recently the group has evolved again, and it's now a nonprofit society. It's called Prince George Air Improvement Roundtable. The person in the group who thought about that is brilliant. And again, it is very broadly based. It has all orders of government in there, in private sector, industry, businesses, and community organizations. And so it really speaks to this whole idea of the interjurisdictional, meaning the many jurisdictions that have a role on something like air quality. So like local government, cities have a say in where industry is located. But the province has jurisdiction over air. So even though a city may say, yes, industry, you can build here because our official community plan and zoning says so, the company cannot actually operate it until they get their permit from the Ministry of Environment for their emissions and any effluent that might be coming out of the operation. And federal, that's why I have the inset here, trains. I know that our trains go through all our communities pretty much in northern BC and elsewhere in the province. And the diesel engines sit there and they run 24/7. They never turn them on. But it's a federal jurisdiction, both the corridor and the operation of the train. So the federal government needs to be involved, as well as the rail, which has participated in the PG Air round. And then, of course, there are ourselves. We make our choices, too, whether we have a wood stove or we use a vehicle, our furnaces in our homes, all those things that we do, too. But example there is the province has a wood stove exchange program to enable residents to turn in their old wood stoves, which are smoke, that are burning the gases and reduce the particulate, their own little stacks in their houses. So So there's lots of things we can do, right, as individuals as well as working collaboratively with government agencies and the private sector. And then the last example is community, very community-based, the community events. We have BC Rivers Day throughout the province in late September every year. It's held in Fort George Park, which is at the confluence of the Nechako and Fraser Rivers, so it gives that opportunity for residents to be in an outdoor setting, adjacent to these just wonderful rivers, and reminds us of our connection to our rivers. Also, the little tiny community of Horsefly, which is east of Williams Lake, they have a salmon festival every year, and you can see the fish here. It's a great winter shot, but the colors that provides, the kids paint the fish and then in their wood, and then they go up on a fence, and you can kind of create. It's called the Stream of Dreams program. That's again available province-wide to local groups. And similarly, they have music and displays, and there's face painting and all those kinds of fun aspects. And the Bike to Work Week, again, a province-wide initiative, and that helps people. So one of the things in this is I wanted to point out the role. It's not always, governments and agencies and ourselves as individual volunteers working with all these other agencies and groups that can make things happen, and it builds our sense of belonging. It helps us action on some things that are of concern to us, as well as create all sorts of things we can do, and it also provides the opportunity to involve others who might not be inclined to do so. Perhaps a particular neighborhood, perhaps a youth group, something like that we can. Now, just to end with this last slide, this is the Fraser Basin Council's logo, sort of our saying, our definition of sustainability, but I just thought it kind of nicely summed our well-being.
Thank you so much, Joan. That was great. And as you know, this webinar series is called the Citizen Series, and the focus of this entire series really is on the role of citizens and communities in affecting health outcomes. So that was fantastic to have some really concrete examples on the ground of what local communities can do to make these links. So I really appreciate that. And again, I see the little applause icon, lots of applause all around. So thank you.
Thanks.
Before we move on, we're going to move into a group discussion, and this is a time for dialogue with everyone on the call. We'll hear some more from each of our panelists. We have a few sort of guiding questions, and we also want to open up the floor to any general questions people may have. Before we move on to the group conversation, if there are any specific questions or comments for Joan, you can feel free to raise your hand or to type into the chat box there. Also, I noted that there was a lot of interest in the report that you referenced about farmers markets, and a couple of people have provided the link in the chat box here. So if anyone's interested in accessing that report, which is called Economic and Social Benefits of Farmers Markets in BC by Dr. David Connell, the link is in the chat box there. So feel again, if there's any questions for Joan, you can let us know, and we're just going to pull up some questions to get our discussion going as a group here. So our first question, we'll start with our panelists, but I also want to extend this question to everyone on the call, knowing that many of you are experts in these fields. You live and work in communities and have lots of experience and examples probably that you want to share. We'd like to hear some other examples where communities are taking actions to make the link between health and the physical environment, and particularly what have been the results. I know I was having a look at some of the conversation going on in the chat box earlier, and I know someone was talking about some motherhood issues that help make the links between health and the environment. And in particular, they were talking about how children can be one of those motherhood issues or ways to link the issues. And in this context, which I understand was in the Comox Valley, salmon was also something that seemed to be a call to action. So there was a mine, there was efforts, countless volunteer efforts, and a lot of money to clean up a mine site in the Comox Valley. But because it was out of sight, the lack of salmon is really what built momentum and alliances. So that's a really cool example that someone shared from the Comox Valley. So feel free, if anyone has examples they'd like to share, you can type into the chat box, or again, just hit the hands up icon, and you can feel free to share your story verbally on the phone as well. We'll start by turning that question back to our panelists. Maya, maybe we'll start with you if there's any specific examples, and it doesn't have to be within BC. Any other examples that you'd like to share where communities have taken action to really take these links and you know, something that's been significant, where you think there's been significant results? I'll just remind everyone, when you're speaking, you'll need to hit *6 to unmute if you're muted on your phone line.
Thank you, Steve. Well, yeah, in a sense, I could answer these questions, but I think in terms of local northern examples, they're good. I think in a lot of the community work that I've done, the linking between health and the physical environment has occurred because that's the lived reality of people, and so people are responding to very real issues. So I guess here I'm thinking about ways in which people can begin to work on these issues without necessarily having to have any of these big global health ideas or even frameworks like sustainable development and so on. So my experience in these kinds of environments is for example, in Latin America or in Southeast Asia, where people are responding to the very real impacts usually of different kinds of agricultural development or agrochemical contamination of their local rivers, their soils, and so on. And so I see that there's a lot of work also within sociology about lay epidemiologists, people who are living in the realities of contaminated environments, for example, and are beginning to articulate that experience for themselves and organize and then create allies with people involved in different parts of the community in terms of planning, or academics in terms of epidemiologists or so on. So I think that the message that I want to give, which is a more general one, is just that it's where people are responding to lived realities and beginning to talk amongst each other and to begin to make the links themselves that results are happening. And you know, in some of my work in Costa Rica, for example, through the agrochemical contamination of rivers and the birth defects that were happening to children, that created a whole momentum that completely changed the reality of that community. But it began with people having confidence in their apprehension of the situation and moving towards it. So I think the take-home message of that is just that we don't need fancy ideas in order to really make the links, as long as we're paying attention to what's happening.
Great, and a great link to the example that we just heard about in the Comox Valley, I think.
Mm-hmm.
Someone else has posted an example here about hosting a Terry Fox run at the Victoria Airport in September 2013, so we'll look forward to that. That sounds great. Margot or Joan, you both shared quite a few examples. Are there any others that you'd like to highlight or bring forward of where you've really seen some interesting results of communities taking action?
I'm happy to build a little bit on your connection with children and youth. I think, Stacey, it is an important piece of this puzzle. It's often where people first. I certainly think that people become tuned into some of these concerns, and because of concerns around children and youth well-being. That's, you know, especially an obvious one is food. But the connection I want to make is that I'm going to land back on the Healthy by Nature ideas. So I was at the Healthy by Nature conference in Vancouver in September last year. what was extremely noticeable to me is that at that meeting there was a lot of environmental educators, there were outdoor recreation people, there were people working in conservation, there were a number of public health people, but I would say the ratio, the health people were the smaller portion in relation to the other groups. But what's clear is that a lot of these groups, particularly environmental education and outdoor education and place-based education, they're actually doing a lot of the things that we might want to imagine in a health promotion youth program. They're actually getting kids involved, they're building social cohesion, they're creating leadership, they're doing a lot of things that that might be seen as a green issue, but is actually achieving a public health outcome. And what's sort of striking is that some of these dilemmas we face, which is that if we know that that's going to achieve a public health outcome, to be really blunt about it, does that mean that Northern Health has to channel some money to an outdoor education program, and what does that look like? And that's where we get into these sort of meaty interjurisdictional things. Teresa's putting her hand up as if she's got an example, so I might let her speak to that.
Well, actually, I think it was a Fraser River Basin Council project that was bringing together youth, predominantly Aboriginal youth, and the Healthy Community Development Program got involved, and we actually facilitated sessions with the youth where they began to research and talk about and understand how the environment mattered to them and what they wanted to do about it.
Yeah.
So we might not be able to fund an outdoor education program, but we've certainly got resources and people who are passionate and can bring skills. And as you said, sometimes public health isn't the leader. We're a cheerleader, or we're a moderator or a facilitator. So that was a local example, and those youth I now look at and see we have leaders. They really blossomed in that process, and it's because the environment mattered to them.
And so that's, I think, it's where, building on what Maya said, where people are responding to their lived realities and they're actually achieving public health benefits by connecting with local issues, and that we just need to do a better job at highlighting those pathways, making explicit why it matters that a youth leadership project with Fraser Basin Council is an investment in health promotion and healthy active living. That there's a lot of pathway work here. Some of it you could get stuck on building all evidence and direct cause and effect, but some of it is that we're actually talking about very convergent social objectives. Social justice, environmental sustainability, public health, these are very converging objectives where there's synergies between programs and work happening locally. I would, to make your brains hurt, there's also synergies happening right up to the international context where, for example, in the sustainable development, the Rio process, 20 years since we had our first Commission on Sustainable Development, there's a really neat document pointing out the health benefits of all of the other Rio conventions. So the Convention on Climate Change, the Convention on Wetlands, the Ramsar Convention on Wetlands, the Convention on Biodiversity, all these other conventions that we think of as environmental things, but are actually long-term investments in broader health and well-being benefits. So at any level, from the global, at the national, at the regional, right down to the local projects, you can start to see those synergies happening.
Great examples. And I know I saw earlier that some of our colleagues from the Healthy by Nature Alliance were on the webinar today, so I just want to acknowledge them and all the great work that they do. Also noticed that one of our colleagues was contributing to the conversation, was saying that they've just participated in a knowledge translation activity that brought practitioners and researchers to work on children's environmental health equity issues. And there were 5 mini projects that came out of that, and there's hopefully going to be a report next spring, so we'll stay tuned and look forward to that. I want to take a conversation. I'm actually going to skip the second question and come back to that because I think it's an important one about challenges. But I'm interested in taking the conversation back to northern BC. We've talked about some of the things that communities are doing. I'm curious about where we see opportunities to make these links in northern BC that are unique to the northern context. I mean, I think we started this conversation by acknowledging how important the physical environment, physical geography is in affecting health and in just setting the context for where we live and how we live our lives. So what is unique about Northern BC, and what opportunities do we see that are unique? So, Joan, maybe start with you on that one.
You're giving me the evil eyeball
No,
here.
no.
Not evil. Well, I guess, obviously being in Northern BC, we have winter, so we need to be thinking about, what are the activities you can do outside in winter. Cross-country skiing, snowshoeing, and just being in the environment and having an appreciation for the four seasons, I think is neat. Because I guess that's one idea. Spring runoff, thinking of things like flooding, and safety and health in that respect. I guess it's just providing those opportunities year-round and thinking about. And some activities can be more expensive, such as downhill skiing, but actually it's fairly accessible, I would say, because the hills are smaller, so cost-wise, and it's good for local economy. Actually, Terrace, I think, is now a co-op. Their mountain, Shane's Mountain, which is neat, a community-based organization. I know what I can say was a good example in Northern BC. In Burns Lake a couple of years ago, a group of young women, teenagers and young women, wanted to create a hockey team. They wanted to make their own hockey team. It's just a healthy lifestyle and something they could do. They got a few volunteers and people helped them with fundraising, and they were great, and it was both Aboriginal and non-Aboriginal teenagers together, which helps with that sense of community there.
Margot or Maya, any other thoughts about the unique opportunities in the north? And I'd also throw that question out to everyone on the call if anyone has any specific ideas they'd like to.
Well, one of the things that has struck me since being in Northern BC, it's a lesson I learned very early on, and then it keeps getting reinforced, which is that, as a New Zealander, it has been a massive learning curve coming to landscapes as vast as Canada full stop, but Northern BC in particular. And there are some realities here that demand creativity, because there is massive expanses and there is not many people. We're talking about resources that are spread over vast distances, and so there seems to be a collaborative spirit in the people that I have encountered, where there's so few people on the ground compared to some of the more population dense areas like the Lower Mainland and other areas. So people here just have to collaborate. And there is something that, there are plenty of obstacles, and we've just been having some little discussions around the table about some of the kind of frustrations that people can run into around governance and accountability. But on the other hand, there's this culture of listening and learning among people that is required, and I think the North actually has a lot to teach, or that diverse, remote, rural, spread out landscapes like this have a lot to teach other environments about how that can actually happen. So that's this webinar is a good example of it in some ways, but I think what I am seeing is that the point I really wanted to make here is that we're not always going to brand these things as a health event. So if you think back to my greening of healthy settings, or getting the healthy edge of green settings, we're not always going to see these as a health project. They'll be championed or attributed to, or they'll be the flagship project of another kind of initiative. But it's a population health investment. And if you think back to Joan's slide with those interlocking circles, with the environment being the biggest circle, and I think it went environment, society, culture, economy. Those are the determinants of health. We know that these are the things that determine health. So when we're investing up there, the examples of those sorts of investments and the reason for health to be at the table in those kind of conversations that's a big and challenging reality, because that's a lot of tables that health somehow needs to engage in. But I think we're learning more how to do that without having to health having to be the big kid on the block, but actually health being an enabling, facilitating and supporting or convening role.
Great. Thank you so much. And I just want to acknowledge that there's still some great examples that different people are offering in the chat box of things that are happening around the province. So just please keep those examples coming, they're great examples. I also saw Dave has, I don't know if it's hands up or thumbs up, so one, just make space if you have a question, if you'd like to ask, or a question or comment, it's just star 6. There's a comment here, I'm still a bit stuck on how we can promote active living and active travel in communities that experience harsh winter weather, extreme cold and snow, and still consider the health of environments. Maybe indoor activities. So I don't know if anyone on the call, any of our speakers would like to comment on that. Certainly that is a different context than lots of other places in the province and in the world that affects the type of activities that we're promoting. Joan,
a few thoughts. Certainly, and I'm thinking of our schools as well as our sports clubs at the community level. Certainly the outdoor activities, I know the middle school that my son was in some years ago, now he's all grown up, but they had cross-country skiing as part of their phys ed program, and just because the high school was near a kind of a natural area and open green space, and also as well, the football fields, the baseball fields, that kind of thing, they just use those for cross-country skiing, and it was part of their phys ed classes in the wintertime. And there's volunteer groups. Cross-country ski clubs, oftentimes they have those kinds of things, and they provide low-cost access. You can rent the equipment like for $5 a day. We have a little tiny ski hill in Prince George in this city. It's I think it's something like $50 a year for a family membership or something, and it costs like $10 a day, and they have low-cost rentals and stuff. So those kinds of things can be there, but I think the schools and the local community clubs are there. And also with climate change, so instead of it being 40 below, it'll only be 20 below, or 15 below, and you can get outside. We still have those cold snaps, obviously. You got to be careful and not be silly and get outside in extreme cold weather and get yourself into trouble. But most of the winter is wonderful.
Great. So some great examples of more active opportunities in the north or in colder climates, and some of our colleagues in the Northern Health Office have contributed to that conversation with some suggestions around some of the similar things around Nordic trails and cross-country skiing, but also the idea of creating collective resources like community skis that are visible in the community hall, things like community skating or local food events that bring people together. So those are fantastic. I'd like to go back to the second question. I think we've talked a bit about this. It's come through each of the presentations, but I'm curious, we've talked about where are some of the challenges in making these links. We've talked a lot about what's happening on the ground to make the links. That said, I think we all know that there probably are some challenges, and I think it would be useful to hear about what strategies have been particularly effective to address the challenges, and maybe combined with that where you see opportunities to promote learning. So how can learning overcome these challenges? Mia, can I turn that back over to you to have your thoughts on where you see opportunities to promote learning and what strategies are effective to overcome some of the challenges in making these links?
Thank you. So I'm going to keep my hat on as sort of the more generalist, big picture thinking person here, not that just because I don't have a lot of examples to offer, particularly from northern BC, but some of the challenges that I encounter in my work in terms of making links between health and the physical environment and trying to embed that within kind of work in the health sector more specifically, is that there are some very pragmatic and practical challenges that we're encountering, and they can be such things as the ways in which we privilege certain kinds of knowledge forms over the other, and so there are whole bodies of knowledge housed in different kinds of archives. Some of them are verbal, some of them are written down libraries, and so on. But finding ways of bringing these kinds of interactions together and valuing knowledge forms is a real challenge, particularly when we're trying to make cases for change, we're trying to get grants to fund these kinds of efforts. And I think another thing is that when we're working with different kinds of systems or organizations or institutions. All these, and we're working across scales from, for example, the national through to the local. Everybody's set up to work a little bit different. We have different mandates, different ways in which people are clustered, and they have job descriptions and so on. And there's different kinds of rewards and funding strategies and so on. So trying to find ways to fit, even trying to identify ways, who will be a partner, a conversation partner or a collaborator in another organization or agency that we've identified would be a good partner, are really difficult things. How to get people to free up time to get permission to sit on a committee, particularly if it's extracurricular and so on. And I think another thing, and this is something I encounter a lot in my work between the UK and Canada and also the United States, but other places, is that different geographical realities and climatic realities and so on bring certain issues into people's imagination and awareness. So, for example, in the United Kingdom, I have a really hard time getting people to think about the deep interconnection between ecology and health, because there's not a lot of great calamities, and it's usually calamities or big challenges that bring this issue to people's awareness. Whereas in the United States, some of the people I've worked with at the CDC there, they're acutely aware of water shortages, and there's water wars, or there's problems like that. So it's a no-brainer that the environment is directly impacting people's health. So I think these are some of the challenges that we work with, and strategies for addressing them. That's part of it is just persistence and really holding a vision.
Great. Thanks so much, Maya. I'm seeing some comments coming in from our colleagues at Northern Health, and I know Margot's there as well, so I'll turn that question back over to you. And I see some comments about the importance of finding ways to value people for crossing boundaries. So anyone that's around that table, if you'd like to share any comments or thoughts about that.
It's Margot here again. We've been streaming some of the thoughts around the table, but one of the things I'd like to reiterate about what Maya was saying is that we have to move beyond. I mean, it is true that crises will move things along, but there are these surprising catalysts that will sometimes occur that you may not have expected, where you can actually suddenly there is an opportunity or a window or a change where you can actually jump on an issue, or it's often as how we were just talking earlier today about when you have the characters, those champions, that's another word, that's another sort of C, the champion that's really pushed something forward, how we can work together to enable those people to gracefully move on and also sort of be building the community around those people to carry on efforts. And those are all, they're very practical. These are social change questions, but they're social change questions about engaging in broader issues. I just want to put on the table something that when I've been discussing these issues at Canadian public health context, is that for a lot of public health people, they have a personal interest in these issues. So we've been running EcoHealth networking breakfasts at the Canadian Public Health Association, and a lot of people will say, these are issues that I value in my family. It's things that I do with my kids. It's my partner works in the environment area. But I'm a public health person. I don't have any time. We're so busy with our core business. I don't have any time to start making these, to be stepping out of this. And so it's one of the reasons that I actually do believe that if you go back to those core public health competencies, there are ways that by doing this, you are fulfilling what is supposed to be part of your job. And so finding creative ways to actually value the people that are making those connections, there are some, again, it's some organizational learning that needs to occur to see that people might not get the quick return, but they might be having the longer term return of building those relationships and integrating their personal commitments for these issues into recognizing actually this is really helping me achieve my public health objectives. So I just sort of put that out there because it's a very common phenomenon. You shouldn't feel alone if you feel like that, and that there is actually an increasing momentum of people saying, oh, actually I can I can get this happening in my practice if I think creatively and talk to the people that I need to see that by making these connections, going to that, serving on that committee, reaching out and connecting with a environment or stewardship or conservation or education activity, I may actually be fulfilling what I should be doing as part of my public health work and finding new audiences and new forms of outreach I never may have thought about.
Great, thanks so much, Margot. Joan, I know you had a comment as well.
Yeah, I just wanted to pick up on the idea of the characters and the catalysts and the roles of individuals, and also wanted to pick up, somebody had a comment there on the side about the distinguishing feature of the North being, the vast landscape, the distances, and the low population, which is very true, and you're right, it's not just winter. But somehow, with community leaders and volunteers, when you're involved in an activity, you just get to know people across the region, across the North, and you get used to driving. I know we're supposed to use our vehicles less and all that, but you just get used to living in those distances, and you support each other. I'm getting the sports volunteers again. You host an event, and people come from across the region to your event, and you go to theirs, and you take turns hosting, regional finals or regional competition of some network grows, and it's so even though you're not in the same community, you are a community of that particular activity for health, which is good for people's health and for getting kids out and active and learning that kind of a lifestyle. The other one I wanted to just point out the role of leaders, of individuals, and just how important it is, to take a chance, take a bit of a risk and get involved. There's an individual who's a rancher in the North Okanagan who has been working for years with agriculture and ranchers and their role in ensuring a healthy watershed and their effects in trying to reduce that on water streams and the watershed itself. And every year he's got this huge email list of several hundred people. They're from agencies, they're like Fisheries and Oceans or provincial, local government, community groups, environmental groups, and he invites them for a weekend to his ranch. For the weekend, you have to bring your own camper and your food and everything, but he does a tour of what he's doing and just provides that opportunity for people to talk, to get together very informally and talk and see and learn, and it's just a...
Great. Thank you so much, Joan. I am being tempted. I'm watching the time and knowing we need to move towards wrapping up today's session, and also see there's some really interesting conversation going on in the chat box. I'm afraid we're not going to have time to dive into this really interesting question, which I think is quite compelling around some of the challenges of power sharing and impinging on territory when you're trying to work across disciplines, across sectors. So maybe we'll leave it today with some thoughts about that. People can continue to add their ideas in the chat box. Unfortunately, I don't think we're going to have time to dive into that into detail. Before we wrap up, I want to point out that on the screen right now you'll see two boxes, resources for download and resources on the web. So if you would like to get copies of any of the presentations from today, you can download them directly from this site to your computer. And you can also link directly to a number of websites, including Northern Health's position statement on the environment as a context for health. Those are there. So please feel free to access those. And as I said, on the BC Healthy Communities website, we will be posting a recording of today's session as well as all of these resources. We also will be following up with a very short evaluation feedback form, and really, really value people's feedback. If you can take just a couple minutes to give us feedback on the session, it really helps us to improve and get ideas for future sessions. And before we close, I'd like to just turn it back over to either Teresa or Julie from Northern Health, my colleagues who I have the great pleasure of working with on this series. Teresa or Julie, is there anything you'd like to say in closing for today's session? Star 6 to unmute.
Stacey, the discussion here was so vigorous that I didn't know if that was directed at me. But in closing, I would like to say how encouraged I've been to see all this this chat and to hear the discussion in this room as well, which does show that when we create the space to talk about these issues, that suddenly things become obvious. So I encourage us all to figure out small and large ways to create that space, to hold the space Sometimes it means being a little bit confused, but often it does actually involve getting quite inspired to see connections that are all quite intuitive to us. So thank you to Northern House for creating this space today. It's been really encouraging.
Great. Thank you so much. And I just want to again send a huge thanks to our guest speakers today, Dr. Maya Gislason, Dr. Margot Parks, and Joan Chess. Very interesting presentations, and I really appreciated the breadth of the presentations and how we were able to hear a number of different sort of perspectives and angles on this topic. It was really great. So a big thank you to you, and a big thank you to everyone for participating. Great to see such a mix of folks on the webinar today, and really appreciated everyone's comments and questions and keeping the dialogue going. We look forward to connecting again in future sessions. Take care, everyone.